Okay, so welcome to Module 3 and to talking about more specifics related to lifestyle medicine components. The topics that we will cover, of course, in this chapter really get into what we call the core elements of lifestyle medicine, or at least what I call them. And those would be in that section of the book that we have the required readings from for this week. And so what we have covered in here starts off with behavior modification. And why is that? Well, behavior modification may be the rate limiting step to everything for lifestyle, healthy lifestyle behavior components. Meaning that you could be someone who understands exercise physiology and exercise prescription to a very high degree, and you write this wonderful exercise prescription for an individual who has, say, heart disease and diabetes. But if they aren't able to follow the program or the prescription, then it really didn't do them any good. You may feel good because you wrote a great exercise program, but it's really not about you, right? It's about them. So keeping in mind behavioral modification, behavioral change, theories, practices, strategies is absolutely critical for lifestyle medicine. And that's why we wanted to start there, to give a bit of a foundation for that. The other, one of the other pieces I wanted to make sure that we had a sort of a perspective on before we kind of really get into readings at a deeper level for the lifestyle medicine components is how do you, which of the lifestyle medicine components are most important? Are some more important than other? I guess that's probably the most a better question. Students ask me this quite a bit, or when I give a lecture, they, some people will say, well, what do you think about exercise related to nutrition or sleep related to alcohol? Which is more important? And it's a legitimate question because sometimes we get into the very intellectual thinking of, say, okay, what does the literature say? Where would I get the most bang for my buck, so to speak, for recommending an activity for someone? Should it be to exercise, or should it be to eat fruits and vegetables, or should it be to get their sleep, or should it be to drink water? And the real answer, at least this is my opinion, is it depends on the person. Okay, so it's not a black and white answer. What does the person whom you are working with need? And that's really the question. So whenever I get that question, I always ask that question back. What does the person need? What are they then, another question, not only what they need, what are they willing to do? One of the things that I hope that you get an appreciation for by the end of this module, and certainly by the end of the class, is asking yourself the question when you're working with someone, what are their barriers? Okay, we know how much exercise someone should do according to our evidence-based literature. We know how much fruits and vegetables they should be. We know how much they should be sleeping. But what are they willing to do? What are they able to do? And that's where we need to get at the meat of saying this is your specific program. This is what works for you. Whenever I meet with people to design a lifestyle medicine program, we have a conversation that it takes at least an hour to talk about what their beliefs and values are related to lifestyle activities. Some people absolutely hate exercise. Some people love exercise. Some people hate vegetables. Some people love vegetables. So you need to know that information before you just go out and say, well, you know what, you need to exercise. You need to walk 30 minutes a day because, that's just a great activity. But it may not be the right activity for them. So which activity is the best? Really depends on the person. And that's the beauty of all of this lifestyle medicine related topics, are that we know that there's benefits from exercise and from healthy eating, from sleeping, from stress management, from moderate moderate alcohol consumption, tobacco cessation. We know that what the benefits say for those, so that's not the question. We can do this intellectual exercise of writing all those things down for someone who has diabetes, and it's And that's pretty easy. The challenge comes, what do they want? What are they able to do? What are they willing to do? What do they have access to? What are their barriers to doing this? Do they have support at home for eating a certain way or for exercising? Do they have the resources to be able to do the things that you think they should be doing, that the literature says they should be doing to make themselves more healthy? So keep that in mind as we go through. This is very much an individual process, and certainly I think some of the activities maybe in some ways have more bang for their buck than others, but it really comes down to what the individual can do. The other thing that I want you to keep in mind also, or I'd like for you to keep in mind, is to not try to be so heavy in one activity versus another. And what I mean is balance is probably a good thing. So sometimes I work with folks who they're just fanatical about exercise, and so they'll exercise 90 minutes a day every day, but then they'll not have any regard for sleep or stress management or alcohol consumption. So they're really good at one, but not so good at the others. And I think there is some literature out there to be able to justify saying if we kept a balance in all things related to what keeps us healthy, we're probably going to be better off in the long run. So balance amount of exercise with amount of sleep, with healthy eating, with moderate or less alcohol consumption, with no tobacco, with stress management, stress controlling skills. The balance of this, and I don't want to leave out other things that could be come under this umbrella of lifestyle. Certainly, interpersonal relationships and spirituality and all of the other components, the important components that make up who we are, and the whole person health model that we talked about in the last module. Obviously, very important. But we're honing in on the other some of those specific things today, and I just want to keep in mind that this is hopefully a balance for them. The last thing I want to mention about this module is some of the things that you may want to keep in mind as you read are, what are the recommendations? What is the recommendation for amount of exercise someone should get, or fruits and vegetable intake, or amount of sleep or water, or that the overall recommendations that the evidence shows us gets us to where we the greatest benefit from doing the activity, and those are listed out in the book, in the chapters as you read through those. And I want to leave you with this last point: is even though this course is advanced lifestyle medicine, and it's advanced for reasons that we've talked about earlier, relative to what this course would be like at an undergraduate level, or is like at an undergraduate level. But within our program, this is still an introductory level course, and we're going to touch on these topics, lifestyle medicine topics, at a certain level, but then you're going to get to a deeper level as you move through the program, and having specific courses on health behavior and nutrition and exercise and sleep and stress. So this gives us a broad introductory view at a graduate level. It would be probably a good way to think of this. And then we go deeper in the weeds as you get through the program. And that's the real beauty of this, is that these, we're going to introduce it, and then we're going to bring it back in a different course and at a different level, and it'll all tie together are all woven together as you matriculate through the program. So enjoy the readings for this week, and I look forward to reading your paper that's due this week, your reflections, and certainly reading your discussions. Let me know if you have any questions. Thanks.